For our pharmacy-based intervention proposal, we chose reproductive healthcare as our topic. Our intervention is entitled, Kontrasepsyon bilang solusyon sa paglobo ng populasyon, a comprehensive reproductive healthcare education program. Why do unintended pregnancies need to be addressed? According to the Commission on Population and Development or POPCOM last December 2020, the Philippine population is expected to hit 110,881,756 by the end of the 2021. This is a projected 1.31 increase from the onset of 2020, slower than the 1.68 growth rate in 2016. However, POPCOM Executive Director Dr. Juan Antonio Perez III pointed out that despite this slowly declining fertility rate, the Philippines still has one of the highest population growth in the Association of Southeast Asian Nations or ASEAN. This high population growth can be controlled through health education for women, men, families, and communities, which can be done through counseling and distribution of contraceptives. Contraception has one of the vital role in preventing unintended pregnancies. According to the World Health Organization in 2019, 85% of the women who stopped using contraception became pregnant during the first year. Some of the women who experienced unintended pregnancy proceeded to abortion process. Furthermore, the WHO stated that in the Philippines alone, it is estimated that there are almost 2 million unintended pregnancies each year and over 600,000 unsafe abortions.
Objective of the proposal. The proposed intervention program aims to make the community pharmacy an extension of the health center in advocating and educating women on the proper use of oral contraceptives to prevent unintended pregnancies and overpopulation. Target population of the proposal. The target beneficiaries of this community pharmacy-based intervention are the first 50 women who are first-time users of oral contraceptives and belong to Class D and E socioeconomic class, Class D for lower middle class, and Class E for lower class, that lives within the vicinity of Clear Pharmacy, East Santos Street, Pinagbuhatan, Pasig City Branch.
Presented here is the community pharmacy-based intervention paradigm.
The raw materials to be used in this proposal. First is the manpower. This includes the pharmacies and the healthcare workers. The pharmacies will be the main facilitator of the whole program. The healthcare workers from the health center within the community will provide the oral contraceptives and will receive the results or data from the program. Second is the record book. This will contain the records of the patients or participants of the program. Other raw materials to be used in the proposal are the Target Client List Form or TCL form, the form that will contain the names of the registered patients to the program, oral contraceptive pills, and posters. The detailed view of the poster. This poster will be displayed inside and outside of the pharmacy to inform or encourage the public about the program. The target client list form that will serve as the registration form for the patients within the program. Details here are the date of the registration, the name, the address, the age, and the type of the client. The interview forms that will contain the detailed background and personal information of the patients registered in the program.
The basic methodology of the proposed intervention is the identification of females using oral contraceptives and the subsequent distribution of oral contraceptives as provided by the health centers. Specifically, the execution of the proposed intervention is as follows. For step 1, the collaboration of the community pharmacy and the health center. With the approval of the health center, the community pharmacy will begin their proposed intervention by acquiring free supply of oral contraceptives. Furthermore, the community pharmacy is to ensure prompt and accurate transmission of information regarding the recipients of the oral contraceptives and their status with the health center. Moreover, the community pharmacy will start to identify itself as an extension of the healthcare center and start the advocacy through posters in the community pharmacy. For Step 2, oral contraceptive users as participants. Customers of the community pharmacy who will purchase oral contraceptives will be given a chance to join the program, specifically the first-time users. The pharmacist will discuss the proposed intervention with the customer and benefit it entails, including the free supply of oral contraceptives and a comprehensive patient counseling concerning oral contraceptives and their lifestyle.
Step 3. Registration and collection of information. Willing participants can register their names to the program and answer a set of questions for further assessment of their use of oral contraceptives. Additionally, the pharmacist in charge is to gather information concerning the lifestyle of the participant in consideration of the possible drug interactions the oral contraceptives may undergo. Step 4. Provision of free oral contraceptives and comprehensive patient counseling. Once cleared with the registration and information collection, the pharmacist will hand the free oral contraceptives good for 28 days and thoroughly explain how to appropriately administer the oral contraceptives. Aside from this, the pharmacist can explain the package insert of the oral contraceptives and evaluate whether the participant understood the instructions. Furthermore, the pharmacist will run comprehensive patient counseling to address the possible drug interactions that can happen and relate the efficacy of the oral contraceptives with the participant's lifestyle. This will ensure that the patient is to receive enhanced patient education or enhanced health outcomes. Step 5. Follow-up, monitoring of compliance, and refill. The participants will be requested to return to the community pharmacy on the 28th day for refill of the oral contraceptives. Additionally, the participants is to report their compliance before having their oral contraceptives refilled. Additional questions may be presented to the participant to further evaluate their compliance and safety on their use of oral contraceptives.
For the health indicators, the following would be used. First is the health status indicator. Under this are the adolescent fertility rate and the total fertility rate. Adolescent fertility rate is the number of births per women who are in the age bracket of 15 to 19 years old, while the total fertility rate is the number of children who would be born per woman. These health indicators are used as one of the goals of this proposal is to prevent the risk of maternal morbidity and mortality, to prevent the exposure of unnecessary risk, especially to adolescent women. Second, we have the cervix coverage indicator. Under this is the contraceptive prevalence rate, which is the proportion of women who are currently using at least one method of contraception. This health indicator could also determine if the program successfully worked, because the increase of contraceptive prevalence rate means that more women are knowledgeable enough about contraceptives, thus using it. The following are the predicted output of the proposal. First, increase patient education about the use of oral contraceptives. Second, increase contraceptive prevalence rate. Third, decrease incidence of unintended pregnancies. Fourth, decrease pregnancy-related morbidity and mortality. And lastly, decrease adolescent and total fertility rate.
For the outcome of the proposal, based on the output given by the proposed program, it may lead to positive outcomes to the community of Pasig City. Specifically, the outcomes are the following. First is the promotion of knowledge about the proper use of oral contraceptives. Second is the prevention of the incidence of unintended pregnancies. Third, prevention of pregnancy-related morbidity and mortality. And last is the control of unwanted population growth.
Future impact in the society. kontrasepsyon bilang solusyon sa paglobo ng populasyon. A comprehensive reproductive healthcare education program will give a positive impact on public health, especially the chosen women population, as this program will educate them on the proper use of oral contraceptives to prevent unintended pregnancies. In addition, this program will contribute to the management and control of human overpopulation, which is among the most pressing environmental issues. Our recommendations. Number 1, the community pharmacist may include and educate other populations group that use contraception methods other than oral contraceptives. The program may include advocacy and education in the promotion of safe sex to prevent certain STIs through the proper use of contraceptives such as condoms. The community pharmacist may initiate a seminar regarding the necessity and beneficiality of the program. Number 4, the community pharmacist may consider partnering with barangay officials to promote active engagement and collaboration on reproductive health care education.